And a good Saturday morning, too. Welcome once again to Health Matters with Dr. Jim Warner of Warner Chiropractic, located at 4855 East State Street in Rockford, Illinois. And Dr. Jim has been practicing for a long time, and he says eventually he should get it right because he's been practicing so much.
Hey, that's a good one, Fred. Yes, we've been practicing for 30 years now. And so chiropractic is the thing I love to do most. And I love to help people. And with chiropractic treatment, you get a natural type of health care that people respond to very well, especially, Fred, when they have neck and arm pain, which is what we're going to talk about today.
All right, so if some people are a pain in the neck, or if they have a pain in the neck, this is what we're going to talk about.
Yeah. We're not trying to remove certain people, but we are trying to remove the pain in the neck.
All right.
Get that straight. Well, Fred, a lot of times people have neck pain. A lot of times people have arm pain. And sometimes there's a correlation between the two, and that's what we're going to be talking about today. When someone comes into our office and let's say their arm hurts or they have arm tingling, numbness, whatever it might be, we need to find out what is causing that problem to see if there might possibly be a pinched nerve in the neck that might be causing this.
One thing that I think people think about, I know I do when I hear about people having severe pain in their arm, is it could possibly be a heart attack.
Absolutely. And so when someone comes to our office, we have to make sure we know what's causing it, if it is from the heart or not. Now, it's always a good idea if somebody is having that type of symptom, particularly on the left side, that they get it checked to make sure they're not having a heart attack.
Right.
Now, this could be by going to the local hospital and have that done. We actually have an EKG machine at our office that we can check for that also to make sure. But if you're having those type of symptoms, it'd be good to get it checked by a heart specialist or someone that does this all the time. But we need to find out if it is causing that. Now, a lot of times people go to a hospital, Fred, with those type of symptoms, and the hospital says it's not the heart. What it really is, there's something wrong with your nerves. And so those type of people come to the chiropractor because the same nerve that gives you the symptoms of the heart problem is the same nerve that the pain goes down the arm when you are having a heart attack. And so it's the nerve that connects the neck and the shoulders, the first thoracic nerve, where it's frequently involved. If that's pinched, that can make it feel like you're having a heart attack.
Right, and that's pretty severe pain, but I guess when you get a nerve pinched off, it does cause, some severe pain sometimes.
Yes, and so we try to find that out. We try to find out when someone comes into our office, what is causing the problem. Is it an arm problem? Is it a sprain, a strain? Is it a bursitis? Is it a tendonitis? That's a possibility. Or is it a pinched nerve? And when we have a pinched nerve that's coming from the neck and goes down into the arm, we call that a neuralgia or a neuritis, or you could call it cervical brachial pain syndrome. There's a lot of different words that we can call it. We can call it a brachial plexus syndrome. There's a lot of different verbiage that can be used, but what it basically means is that there's nerve pain going down the arm coming from the neck.
Now, do you sometimes feel pain only in the arm and it's a pinched nerve in the neck?
Sometimes you do, and that's why it's a fooler. A lot of times, Fred, when people come to our office, and let's say they're having neck and arm pain both, and we start chiropractic treatment, then usually the neck pain goes away first. And people say, well, boy, I came in when my neck was bothering me. My neck is feeling good now, but I'm still feeling it going down my arms. And the problem is, Fred, is when there's been nerve damage, the nerve is actually damaged in the neck. It may take weeks or months before it actually heals, because the healing starts right where it was pinched, and then it may take several weeks or months before it goes down to the end of your fingertips even. So it takes time sometimes for these things to heal.
But nerves can regenerate to some extent?
Nerves can definitely regenerate, and so that's why it's so very important to get it checked. And Fred, if you get it checked sooner, it's the better. In other words, if you pinch a nerve and you feel pain in your neck and arm, and you go to a chiropractor and he or she fixes that, that'll get well quickly. But if you've had it for weeks or months and that nerve is damaged, like you said, then when you fix the problem in the neck, it may still take weeks or months to heal.
I know that when people have had partial paralysis, for instance, or full paralysis, maybe they're a paraplegic or something. In some cases, their nerve has been damaged and it doesn't regenerate.
Absolutely. If that nerve has been severed, let's say, I mean, it's been cut, it may never. Now, sometimes they found some that have grown back together, but it may never recover. So it can be a permanent problem. Sometimes people come into our office and they have a permanent problem. They just let this thing go too long, and so they've lost certain things, like they might have lost feeling if it's in their arm. They may lose grip strength. One of the things that we always do when someone comes into our office is we check the strength of the muscles. Now, if you're right-handed or if you're left-handed, you should be a little bit stronger on the dominant side, maybe up to 5 pounds stronger. But if you're weaker on that side, then there's a good indication that there's pinched nerves that's causing that weakness. It's not because it's a lack of exercise, because if you're right-handed or left-handed, you probably use that hand more. So it wouldn't be a lack of exercise, but it's a pinched nerve. And so the hand grip test, where we actually physically measure the strength, gives us a good indication if there's a pinched nerve in the neck.
Now, when a person comes into your office, and I know that you get a lot of people with this type of a problem, is it usually because of an acute injury of some kind, or is it something they know that they've done and it's created the problem, or does it just show up sometimes?
All three. That's a good question, Fred. A lot of times someone's been in an auto accident, and I can think of people that came in just this past week that they were in an auto accident and it's caused pain down their arms and numbness and tingling. So it's something that they say, boy, I know it happened on such and such a date, and they can pinpoint it. Others, it may have taken some time to show up, and some, maybe they had an accident 5-10 years ago. I had someone like that recently. 10 years before they had an accident, now they're getting symptoms. And then when we take x-rays of this, Fred, we can see that there was an old injury that never was properly cared for, and so that nerve started getting pinched back 10 years ago, let's say, and then now it's caused a definite weakness or a lack of conductivity along that nerve root, and so there's a definite problem.
So what is the process for the person? You use the little instrument, the activator, or?
Yes. Well, Fred, first thing that we do is we try to locate where the problem is. And usually when you're having something like this, it's usually getting pinched by the bones in the neck or the top part of the thoracic spine or that hump area between right above your shoulders, okay? And so we will look at those vertebrae and we'll see if those vertebrae are properly lined up. And if they're not, then that tells us where the pinching has taken place, and then we try to restore the alignment of that spine by gently using an instrument, if possible, moving that bone back into a proper position, and then trying to make sure that it stays in that position. And if it stays in that position, then the healing is going to take place.
Recently, I heard of some famous athlete having a problem with a bulging disc in the neck area. Could that cause that type of a problem too? Or?
Absolutely. And with that type of person, not only do they need the chiropractic treatment, they may need different physical therapies, things that we do in our office. It might be a type of traction that you do that helps pull that bulge back. And so there are other things other than just the chiropractic adjustment that might need to be done to effect a cure. Occasionally, it's so severe that it might require surgery. And so we would refer that type of person out if we think that surgery is the answer.
Does the ice therapy help ever in this type of a problem?
Yes, it does. A good question. Yes, it does. When someone initially hurts their neck and they have the arm pain, ice, we recommend the first 24, 48 hours would be important because that reduces the swelling. Where that nerve is getting pinched, Fred, there will be swelling, and so there's a lot of irritation. If we can lower that irritation, ice is one of the best things that you can use for that.
Is it normally, I asked you, the different types of thing that can cause it, but what about a repetitive type of thing that a person does on the job with their neck or turning or whatever? Can that cause that problem?
Another good question. Yes, it absolutely can. And so repetitive things, especially like, Fred, if maybe they're looking in one direction all the time. We find this with maybe somebody that's doing a lot of keyboarding maybe secretarial type duties where their head is always turned to one direction, and it's that way for hours and hours at a time, yes, definitely there are symptoms there that we can correct. And also, Fred, then it's important for that type of person to be doing exercises in the opposite direction to bring balance to the spine.
I know the same principle applies. We've talked about carpal tunnel in the past, and if people do a reverse type of exercise to offset the repetitive type motion that their carpal tunnel has been caused from, it can help.
Absolutely. With carpal tunnel, Fred, usually their grip strength is pretty good on someone because they're using those muscles all the time. And some places that they go to, they erroneously tell them they need to strengthen their grip, and they give them rubber balls to squeeze, which makes the problem worse.
Wow.
So, you have to exercise the opposing muscles, the muscles in the back of the hand, and it works the same way. If you're always turning your head to the right, and you do that for hours and hours at a time, you need to do some exercises turning the head to the left to bring balance. If you're always looking down with your neck in flexion, you need to look up. And part of the exercises then would be to look up to bring some extension into your neck, and then that helps bring balance again to your muscles in your neck.
Now, you were telling me off air before we got on here recording this that you have some type of test so people can understand what their problem might be.
Yes, we have what we call our neck pain index. And if people would like to call us and request this, or go online and just send us an email and request the neck pain index, it's a questionnaire of 10 questions that will tell us how disabled your neck really is, or how bad the problem is, which can help us to determine what's the best type of treatment for it.
Okay, and your website is found where?
At www.warnerchiro.com.
warnerchiro.com. And the phone number, of course, is important.
815-398-8111, and ask for the neck pain index.
All right, then. I hope we haven't been a pain in the neck today. I know we've been informative, and that's the important thing.
Very good. Well, have a wonderful weekend.
Thank you, Dr. Jim, and that's going to wrap it up for Health Matters today.